Hey there, I'm Dr. Nicola. I thought it would be helpful if I recorded this video, like helpful things to know before your first appointment with me. And I'm going to go over some of the things that I find myself talking about like time and time again in our first visits or my first visits with my new patients, that can be brand new information. And I thought it might be helpful just to hear it from me once ahead of time. And then, of course, we can go over it again in your own appointment. But just some of the sort of more general concepts of Lyme, why I choose the testing I choose, why I sort of start with certain treatment choices, etc. And then I'm also going to go over some logistics of working with our practice. So the first thing I want to say is if you are coming into Restore Medicine and becoming a patient of ours, welcome. I really, really love and cherish the relationships I have with my patients. And so I want to make a promise to you right here, right now, that I will give you the best care that I can give you. And I will never tell you that you're crazy. I will never tell you that your symptoms are all in your head. And there is nothing you could tell me that would shock me anymore. So step one, just know that you're in a safe place and that you will be listened to and that we will take as good of care of you as possible. So let's talk a little bit. So your first appointment when you come into Restore Medicine, whether it's with me or one of my associate doctors, will be an hour. So we do ask you to submit your paperwork at least 48 hours ahead of your appointment. Just, if you have a lot of labs or, when we want to make sure we can get you in the system, and then I can kind of review your information ahead of time. So we ask that you get your information in 48 hours. And also, if you need to make any changes to your appointment, if you need to cancel or postpone, you do give that within 2 business days is our cancellation policy. So if we don't have your paperwork within that time frame, we will probably need to reschedule you. It's not us being mean, or we just want to make sure that we are prepared ahead of time and we have all your documents uploaded and your chart created and all of those kinds of things. Logistics, if I'm seeing you in office, wonderful, come on in. We are very dog friendly. We have a couple of dogs that hang at our office. They are very gentle, sweet dogs, but if there's a problem, if there's an allergy, if there's a fear of dogs, if you'd rather just not have the dogs be there, please let us know and we will happily accommodate you. If you're on video or on phone, I will call you. I try to stay on time, but sometimes I'm running a little bit late. It's not usually more than 10 minutes. If in doubt, if you're sitting there going, oh my gosh, have I got this right? Or I've clicked the link correctly or whatever, then sure, reach out to our office. But just know that I will call you. You don't have to call in. Just maybe give me some grace of like 10 minutes, 15 at the most. But if I'm 15 minutes behind, we will definitely reach out to you and let you know. So maybe you give me a 10-minute like wiggle room, but I will be there for you. What else? So let's just talk about some of the things that I find myself talking to everybody about in that first appointment. And like I said earlier, we can talk about it again, but I just thought it might be helpful. So primarily what I'm doing in my practice is treating, well, certainly chronic complex illness. So Lyme disease, mycotoxin illness, mast cell activation, things of that nature. And I do treat very holistically and integratively, which means, firstly, if hormones are off, we can work with that. We can work on gut health. We can work on detoxification. With these complex illnesses, it's not just one thing. And so I'm actually very big on, if you're looking for someone just to prescribe antibiotics for Lyme, then I'm probably not your person, because I do a lot of antibiotics for Lyme, but I also want to look at all the other things going on in your body. And systematically, we can't do everything all at once, of course, but there are so many different facets to this illness. And that's true of mycotoxin illness as well, or heavy metal toxicity, or MCAS, whatever the case may be. There's no sort of one quick fix. So just kind of coming in with that sort of expectation, I guess, is kind of helpful. Looking at testing, I want to just explain who I use for testing and why. So I'm big team IGeneX. IGeneX is a specialty Lyme lab. They've been around for years. They're what I would consider gold standard in the industry, or at least amongst like the doctors, the group of doctors, like the ILADS doctors, for example. IGeneX is costly. It's spendy. The panel I run is about $1,650 at the current time. There is a slightly better one that's closer to more like $1,900. The $1,650 is like kind of my go-to landing panel, and that does test for Lyme and all the major co-infections. So I understand it's a chunk of change, but we want the best quality testing we can get. I have concerns about the Vibrant tick-borne disease panel, and I don't want to badmouth anybody, but I am here to tell you that I believe that there are some issues in the interpretation of that test. If you have a Vibrant test already and you bring that to me, I can work with it. I'm not going to have you necessarily start all over again and do the IGeneX if you paid for the Vibrant. But if we're ordering Lyme testing and I had a choice, then IGeneX is the way that I would want to go. There are times that we do run the Vibrant testing if you're coming for SOT therapy, for example, and if you don't know what that means, it's slightly beyond the scope of this video, but you can YouTube and search for my name and SOT and you'll find our webinars and introductory things on that. But in that's really the only situation that I would choose Vibrant. Otherwise, like I said, I have concerns about the way they interpret when they report their tests. I understand it's a much more affordable panel. And if you want to know more about sort of the details of why I choose not to do Vibrant, I can share that with you. I'm not going to take up too much time on it now. But I am team IGeneX all the way. And so if you're coming in and haven't had any Lyme testing, that's what I'm going to be encouraging you to do. Okay. So what else? Oh, also the basic Lyme testing through LabCorp Quest, some of these bigger labs, is not sensitive enough. And so again, like people who, by the time they come to me, they're looking for a Lyme expert, they pretty much know that, you know, their standard ELISA test through LabCorp is not like a highly sensitive test. However, where I see people get in trouble is if they've had a Lyme test in the past and it's been negative, then whoever ordered it was like, oh, look, it's negative, you don't have Lyme, all done, end of story. And they go along thinking that they don't have Lyme and they're sick for another 10 years until they sort of think, well, hang on a minute, sounds like Lyme, so maybe I do have Lyme. All right, so if you've had a negative test through LabCorp Quest, it doesn't mean you don't have Lyme. If you have a positive test from them, it pretty much means you do, because like I said, they tend to be undersensitive. So we see more false negatives than false positives. So if, you know, whatever tests you've had that seem relevant, I don't necessarily need every blood test dating back 15 years, but please try to get us ahead of time. Any Lyme testing you've done, any mycotoxin testing, heavy metal testing, like recent blood work, hormone testing, things like that. It happens quite a lot where I'm in a first visit with someone and we're talking about a result or talking about a lab test and they're like, oh, I should have got that to you. You know, it would have been helpful to see. So please, if you have relevant testing, try to send that to us in PDF form electronically ahead of time. Or if you want to send it, you know, if you're in hard copy, then we can scan it in, but we do everything digitally and electronically. Please do not take a picture of it with your phone. I can never open those files big enough so that I can read it all. So we do really need it scanned. But if you can try and have that to us ahead of time, and that way, you know, I can take a peek at it, and then we've got it to talk about in that first appointment, that's super helpful. All right, so then talking about treatment, there's a few things I need you to know about the Lyme type pathogens that make sense of how we treat. Okay, the first is what I call the 3 Bs, right? Borrelia, Babesia, and Bartonella. These are the 3 major pathogens that I'm looking at. Now, there is also Ehrlichia, there is Anaplasma, there is Rickettsia. Those things are all tested for with the IGeneX panel, but in my opinion, they're more secondary. And typically whatever we do to treat Lyme is going to help with those as well. Babesia and Bartonella are the really standout ones that I want to look for. And they have sort of slightly unique symptom pictures, right? So with Babesia, I'm looking at night sweats, temperature regulation problems, blurry vision, ringing in the ears, dizziness, feeling woozy, shortness of breath, air hunger, chest pressure and pain, like feeling like you've got an elephant on your chest, heart palpitations, easy bruising. Those are typical Babesia symptoms. Bartonella loves the central nervous system. So Bartonella can cause a lot of neurological issues like seizure-like activity, migraines, ice pick headaches, severe anxiety, panic attacks, OCD kind of behaviors. Like my Bartonella folks will often say to me, like, from here down, I can live with it. From here up, I'm a hot mess. And so that's kind of one of the things that, you know, helps us to differentiate is looking at symptom pictures. The other thing that's important to know is that the Lyme bacteria can exist in 3 different forms. We have the spirochete form, the cell wall deficient form, and the cyst form. Okay. I tell people, think of it like we've got the caterpillar, the cocoon, and the butterfly. They're theoretically the same creature, but look and act very different depending on where they are in their life cycle. The difference with Borrelia is that they can go back and forth. So can go from a spirochete into a cyst form and then emerge from cystic form back into as a spirochete, right? So it's sort of bidirectional. This is important, especially if we're doing antibiotic therapy, because to effectively treat Lyme with antibiotics, slightly different with herbs, with antibiotics, we have to cover each of the 3 forms. So sometimes when people are thinking over whether antibiotics are right for them or not, they're saying, well, could I just do doxy for 6 weeks? Like, or could I just do doxy for 3 weeks? And I'm like, no, because that's only going to get one form. And this is where a lot of people have failed treatment with other practitioners, because not even all Lyme literate practitioners treat this way, which I don't really understand because I feel like they should know this. But that being the case, to treat Borrelia effectively, we have to cover the spirochete form, the cell wall deficient form, and the cyst form. Okay, so you're signing up for more than one antibiotic. Some of them we can pulse, and some of them, you know, it's not necessarily everyone every day, but you're signing up for 2, 3, usually 3 antibiotics, right? So just know that going in. Then we've got to treat whatever co-infections are present as well. And Babesia especially is it's not a bacteria, it's a protozoa, meaning it's a parasite that lives in the red blood cells. And it can destroy the red blood cells. It's not an intestinal parasite, it's a red blood cell parasite. It can destroy the red blood cells, you know, leaking oxygen, then leaking iron, contributing to a lot of the fatigue and the weakness. So that's just education for you. We'll go over it again. There's nothing you need to really figure out ahead of time coming into your appointment. I'm just introducing you to concepts that you may be aware of or that you may not, right? So just kind of the more we can have repetition and go over them, the more it makes sense. So we've got the co-infections, we've got the 3 phases of the Lyme bacteria, then we have biofilm and other stuff that complicates it. We will definitely address that, so don't worry too much about that at this point. The other thing that I want to talk about is why I start with herbal treatment first, 99% of the time, right? So some people come in and they'll sit down and they'll go, okay, I want to start antibiotics now. And I'm like, oh, okay, well, let's, wait. We've got to do a little prep work. We've got to do a little investigational work. And yes, if you want to do antibiotics, we can jump into that, but it's not going to be straight out of the gate, most likely, unless there's a recent exposure and time is of the essence, right? That's a different thing. The reason for that are numerous, but most of all, when we start with herbal antimicrobials, I get to see how sensitive your body is. How much of a Herxheimer reaction do you have? How do you tolerate treatment? Without the potential side effects or the confusion of having antibiotics on the plan as well. So if somebody starts an antibiotic and doesn't feel great, there's a couple of things that can be going on. They could have an allergy to that antibiotic. They could be having side effects from that antibiotic, or they could be having a Herxheimer reaction. And so with antibiotics, it's just a little bit more confusion, right? Herbs tend to have less side effects. People are much less frequently allergic to herbs. And so I get to learn your body and your responses and your reactions from a slightly more gentle standpoint, even if our end goal is going to antibiotics. Right? So just please understand that this is Like, this is for your safety. It's also that when we get to the antibiotics, I can select them the most effectively for you because I know, do we need to be more gentle? Can we be more aggressive? How is this person's body going to handle this? I always also start with detoxification support before we even do any antimicrobials, okay? And that may be even just a few days or a week, but making sure your detox is well supported will help you to tolerate treatment better. And it will actually save time and make everything more effective in the long run. I want to outline my co-infection provocation, just the concept of it, because I do tend to choose this in a certain number of my patients because it's such a helpful tool. So I talked about the 3 Bs, right? Babesia, Borrelia, Babesia, Bartonella. I have developed something called a co-infection provocation, which is a system that I've used over the years to try to discern which co-infections are present for you, which co-infections may be dominant for you, which co-infection may be contributing to which symptoms. Okay. And also just your overall level of sensitivity that I was talking about a minute ago. So how it works, and if we were to do this, if this is the right choice for you as an individual, because I treat everyone as an individual, there's no cookie cutter approach here. But the concept is I make sure detox is well supported first. Then it's a 3-step process. So detox helpers, then a herb that has more of affinity for a target for Borrelia, wait at least a week, introduce or add on to that a herb that targets Babesia, wait a week, add on a herb that targets Bartonella. And I'm looking for how you respond at each step. So do you have improvements? Do you feel like you herxed? Which symptoms flared, if any? Now, obviously the goal when you come under my care is for me to help you get better. But sometimes if there is a herx reaction or a flare-up of symptoms in the beginning, that's feedback, that's information that I can use to help plan your protocol and help proceed with your treatment in the best possible way. So some people might for example, might be, oh yeah, I started the Lyme herb, the Borrelia herb, no big deal, didn't really notice. And then, oh, but when I started the Babesia one, my night sweats got worse, or I noticed that my sleep got disturbed, or my vision got clearer, or, whatever the case may be, that information is important. So I have you take notes along the way, because when I see you back after that, I'm going to be like, okay, what happened step 1, 2, and 3? Okay. If we're doing this in conjunction with lab testing, then it's perfect, because at the end of the month, when we have your hygienics panel back, then I look at that. And then we talk about how you did with the co-infection provocation. And we put those 2 pieces of information together and say, okay, this is what the lab showed. This is what your body just told us. How do we marry those 2 bits of data and then make decisions about how to move forward? Okay, so if you're on the more sensitive end, we dose you more gently. If you're more, constitutionally less sensitive, we can dose a little bit heavier, but still with the herbs, it's always moderate dosing. It's not super aggressive, because as I said in the beginning, I don't know your body well yet to know how you're going to respond. But just know that that co-infection provocation has been such a helpful tool for me to discern with those 3 Bs, what are we dealing with here? And what's our biggest problem? What do we need to go after first? Where do we need to start, right? The other note that I wanted to make, sorry, jumping around a little bit, but I forgot to mention this when we were talking about testing, is if you haven't had a mycotoxin test, I'm likely to suggest that you do one. And that's just because these days I'm realizing how closely tied chronic Lyme and mycotoxin illness are, how they tend to go together. And so that's also really important for me to have. There's other tests, like adrenal testing, heavy metal testing, food sensitivity test. I don't necessarily require all of that in the first meeting. So don't think that you're going to come in and I'm going to say, okay, now you need to spend $4,000 on tests. That's not kind of the way I am at all. There may be things that are helpful to explore over time, but the mycotoxin is a test that I like to have kind of sooner rather than later, just because it will potentially shape where we go, how I prioritize your treatment. So then during care, again, just setting expectations, letting you know how things are going to go. At least in the beginning, we need monthly appointments, right? So I want you to factor that in just on in your head for your time, for your finances, etc. Monthly appointments are so important so that we can keep you moving forward. So that if we've chosen a medication that's not right for you, or if you're having some reactions, or that if you're not getting the response that we were hoping for, we can course correct and we can adjust. So I always say that treating Lyme is like a game of chess, right? You sort of know where you want to be 3 moves ahead of time, but you've got to be flexible and you've got to be adjustable. And sometimes there's a course correction and little tweaks that have to be made. So the monthly appointments are really, really important for me to do that. If you are on antibiotics, they're crucial because we need to be getting monthly, call them safety labs. It's just 2 very simple labs, a CBC and a metabolic panel monthly when you're on antibiotics, just to make sure your liver and kidney function is good, check your white blood cell counts, make sure there's nothing funky going on. So that's just for your safety, but also the monthly check-ins are so important. So I had a patient the other day that I saw, and then we did some antibiotics, and they came back a few months later, and they're like, oh, I didn't really feel like I was getting anywhere, so I stopped them after a month. I'm like, well, had you come back, we could have like changed up your protocol and like made sure that we were going in the right direction. So please think in terms of monthly appointments. The consistency is important for me to track your progress, make sure you're doing well. I'm going to make sure we're covering all the bases that we need to cover. And because Lyme is complex, like we need that for updates. Like if you come back 6 months later and go, okay, now I've got to talk to you about this, and this, and we've got a half-hour visit, like it's just, it's impossible. So it's best for all concerned for us to have that consistency. The reality, so communication between appointments is a really important one. We get inundated with emails, as I'm sure everybody does in today's day and age. So in between appointments, email communication is for, oh, this happened, like I started this happened, what do I do? Like if you need help with navigating Herx's reactions, and we have handouts that we give you, and I try and sort of set the expectations of Herxheimer reactions and what that can mean. But so if you need clarification on like, okay, I'm feeling worse, should I pull back? Should I stop this? What should I do? Yes, by all means, reach out by email. For help with appointments, or just if you need clarification on a treatment plan, like, oh, I think I've got this right. Am I doing this 3 days a week, or when do I start this? If you need me to clarify, then yes, email. If I can just send a quick response, absolutely fine. All treatment planning has to happen in a visit, right? So if it's like, okay, I've done that, what do I do next? Or, oh, I changed my mind on antibiotics, I'd rather do a herbal protocol. How do I put that together? Like that all has to be done within a visit. Again, it's mostly for your own safety and for the best effectiveness of our care. But then I'm sitting down with you. I'm charting everything you're telling me. Like we're making decisions together. And just honestly, for me as a practitioner, when someone emails me out of the blue and says, I've got a headache, why? I don't mean to be mean, but I'm like, I don't know. Like, did something change? Did you get exposed to something? Did you add something new? Like without a conversation, I don't have a magic ball. I wish I did, but I don't. So I need information back and forth from you to put the picture together of why certain things are happening. So if I can shoot back a quick response by email, I try to be helpful. And like we do respond to emails within 24 hours, 48 at the most, but I'm pretty diligent. Even when I'm on vacation, the girls are sending me emails. If it's not admin stuff they can handle, I'm responding. And I'm very, aware of the responsibility that I need to provide for you as your practitioner. And at the same time, if it's like several questions, or if it's something that I really need to like talk it through with you to work out, we'll ask you to set up an appointment. So email is slightly better for us than phone, just because if it is a medical question and my staff need to send it on to me, then it's even easier to do that by email. All correspondence goes through the info at RestorMedicine. Absolutely, categorically everything, because my staff then, that goes to the front desk, they then keep track of it. They make sure that people have been, gotten back to, it's then filed in the right place. So don't be offended if you don't get my direct email. Nobody does have my direct email, nor my cell phone. I do not give out my personal cell phone number. So on that note, just as I'm thinking all the things, on that note, if you have medical needs, concerns after business hours, then please go to urgent care, go to the emergency room if you need to. I understand fully that they're not really going to get it. and that it may feel like a futile endeavor. But the bottom line is we don't have an after hours on-call doctor. We can't provide that extent of coverage. And so if in doubt, play it safe, go to the ER, go to urgent care, and then let us know what's happened and we'll get right back to you. What else? My staff really try to be awesome. And so we really try to provide good care. We try to be responsive to emails, responsive to medication refills. Please just, plan ahead. You just give us a little bit of grace. We are a small office. I have chosen to keep it that way over the years. But we are a busy practice, so we do the absolute best we can. If you haven't heard back from me in like 48 hours after you've reached out, then by all means reach out again. But generally speaking, we're good at that. We also understand that chronic Lyme and chronic illness, mycotoxin illness, all the things are tough. And we understand that you're often in pain. We understand that there's often cognitive dysfunction, like challenges with memory and focus and things like that. And so creating appointments can be challenging. Our appointment system does send you out reminders, multiple reminders actually, and triggers an email when you set up your appointment. So we do have that 2 business day cancellation policy. Just because if you do need to reschedule, it gives us the opportunity to offer that space to somebody else, so that we can have people being seen in a timely fashion. And so again, I say this with love and compassion, but one thing I really won't tolerate is people being rude and mean to my staff, nor me, but what I've found historically, and it happens so rarely, but we have had a few cases where, a patient would be lovely to me and then really mean to one of my staff. And I really stand behind my staff. Like, they're very important and they keep the office flowing well. And so if you're having a bad day, like, we understand that people have bad days and this is a frustrating illness and that things happen, and we try to be loving and compassionate. But please also just realize that I will hold those boundaries for my staff, because they are doing the best they can and they're showing up to be the best person that they can for you. And it's not okay for them to be treated badly. So I will protect them like a mama bear. They are my cubs. And but just know that we're doing the best that we can for you at all times. So I think that sums it up. I hope that was helpful. I will do an update if anything else comes to mind, but I think that gives you a little bit of an overview, just again, a chance to get to know me a little bit better, but also just sort of an overview of the setup of our practice, how things work. And then again, a little bit of education on things that we may go over in your first visit, just so it's not brand new and foreign to you. So signing off, look forward to working with you. Take good care and have a blessed day.